Now to the very latest on the coronavirus. And Sonoma County health officials say 18 cases of the highly contagious Delta variant have been found in that region. Researchers have been keeping a very close eye on this particular strain. Joining us now to talk more about it is Dr. Peter Chin-Hong, UCSF infectious disease specialist. And Doctor, always a pleasure to see you. How concerning is this?
I'm the most concerned ever about this variant, Heather. It's variants. It comes in, it bites, and it doesn't let go. It's really overtaken the landscape everywhere it goes. It's 90% of all UK cases now. It's doubling every 2 weeks in the United States. Even if you look at Sonoma, just a couple of weeks ago, it was 1% of cases, and now it's about 10% of cases. So I think it's something to be worried about. It's something to respect.
Okay, so it's something that we know is highly contagious. What about those who ultimately contract it?
So people who get it are largely unvaccinated individuals. When you look at the outbreaks in the UK, they are largely unvaccinated folks in parts of London and in the west part of the UK. So that's the part that I'm worried about. In unvaccinated communities in the US, unvaccinated states, and particular districts or counties, even in California, when this comes in, it probably requires a larger number of people to be vaccinated. So I'm thinking some communities in the Central Valley, some in Southern California, like San Bernardino, Kern County, etc.
Yeah, where the vaccination rates are much lower. Is this variant, though, does it produce more severe illness?
So that's controversial now. Many people do believe that it does. The two superpowers that we know about so far about Delta is that it's more transmissible, that like you said, about 50% more than the Alpha UK variant, which itself is more transmissible than regular COVID. And the second part is the part that's most concerning, which is that it can evade vaccines. You need to get 2 doses of the Pfizer Moderna. 1 dose is only 30% protective against Delta. And, otherwise, it's not really going to confer you the same. If you don't get immunized and you just have natural infection antibodies, it may not be good enough for the Delta.
Okay, so when you're looking at things here, Doctor, do you think that this variant will ultimately become the dominant one here in the Bay Area and the U.S.? And if so, what are the potential consequences?
I think what we're going to see, Heather, is not necessarily a huge surge in our area. Northern California is really good. We have the highest vaccinated counties in the country, actually, in many of our counties. But you will see regional outbreaks, particularly in counties where they haven't had as many vaccinated folks, even though they were hit hard and have some natural immunity, because that natural immunity may wear off. I'm also worried mainly about the states where there hasn't been a lot of vaccinations, where we'll see regional outbreaks. So again, it's going to be 2 USAs coming up in the next few months, those that have been vaccinated and don't have Delta, and those that have been vaccinated, and don't have it, and those have not been vaccinated, where there are going to be surges of Delta.
Obviously something we're going to continue to keep a very close eye on. Dr. Peter Chin-Hong, always a pleasure. Thank you.